Welcome to the 20th annual New Orleans Summer Cancer Meeting here in the Roosevelt Hotel. This wonderful and beautiful hotel in this vibrant city such as New Orleans. So here with my esteemed colleague and great friend, Professor Sanjiv Agarwala, an expert, renowned expert, national and international in melanoma. So thank you, Sanjiv,
Thank you,
for being here again. Again, a great presentation. So in melanoma. So tell us about a question that everyone always asks. What happened when the patient unfortunately failed immunotherapy as a first line? What would be the algorithm for those patients?
Firstly, Edgardo, before I answer your question, I want to thank you for once again putting together such an amazing meeting.
Thank you.
Intensive, all the diseases, and gives us a chance to interact with specialties that we don't always do that. And thank you for inviting me. Your question is perhaps the most important question that we would ask ourselves in melanoma today, because that is an area of unmet need. And I will just clarify your question a little bit more, because we are, of course, treating the patients who are BRAF positive with BRAF therapy after immunotherapy, and then they're refractory. There is no good treatment for them. Right now, we have the T-cell therapy that I talked about, lifileucel, which is FDA approved. It's a little complicated, but it's doable. It's much more doable than it used to be 25 years ago when it came out of the NCI. It's applicable to a subset of patients, and the results are quite good with that, long-term durable responses. Outside of that, there is nothing yet that one can offer outside of a clinical trial. I think, that is where the research needs to be done. You are very much an advocate of tumor biopsies and liquid biopsies, and we need to do some more basic scientific research to find out what is the reason those patients are refractory and find the right treatment for them. So unfortunately, no short answer, Edgardo, but that's the way it is.
Good. And I think that I listened from your lecture that we don't treat a patient with melanoma first line with monotherapy immuno. So we use combination, either nivolumab, ipilimumab, or nivolumab plus relatlimab.
Correct.
So sequence. If there is any specific patient characteristic that may you to go toward one of those combinations against the other one, and then the second question here is, if the patient failed, nivo, relatlimab, for example, can we use ipi-nivo to rescue?
Perfect questions again. So first point is that, as you mentioned, both those immunotherapy combinations are FDA approved and available, ipi-nivo and nivo-relatlimab. They have not been compared head-to-head. The differences are between the two, just looking at the data, is that the data looks somewhat similar. There is a longer track record with ipi-nivo, of course, and the more aggressive patients, if you will, brain metastases, liver metastases, high LDH, they seem to do better with ipi-nivo. So ipi-nivo is probably a stronger treatment.
Yeah.
So patients, you asked the question about which type of patient. So a patient that is a little more frail, someone that I would prefer to give monotherapy, but now I don't use monotherapy anymore, I would give for them for sure LAG-3 anti-PD-1. So rela-nivo, okay, instead of nivo alone or pembro alone. But for most other patients, until we have randomization, I personally would prefer ipi-nivo because it has a longer track record. We're very good at managing toxicity, but it is a patient's preference problem.
Good. If you go on nivo relatlimab, can you switch? Can you rescue some patient with ipi-nivo?
So the other way around has been looked at better. Can you use relatlimab, nivolumab, and ipi-nivo failures? The answer is no. It does not work very well. The other way, I'm not aware of any good data to answer that question yet. It doesn't happen that often, but yes, I think there are some patients that could be rescued.
Okay.
But the other way around, if you're given ipi-nivo, giving relatlimab, nivolumab based on the data we have does not seem to work.
Okay, thank you, Sanjiv. Well, so I really appreciate this answer, Sanjiv, and especially for our audience. And once again, I invite you to come to New Orleans next year for the 21 anniversary of NOSCM here in New Orleans, here at the Roosevelt, July 17 through July 19. So everyone is welcome. I promise you that if you come here, you will love this meeting, you will stay forever. Thank you.